Hi, welcome back to my channel. In this video, I will brief you all about the kidney stones. Kidney stones or renal stones are formed within the kidneys, and this is called as nephrolithiasis. Urolithiasis is a condition that occurs when these stones exit the renal pelvis and move into the remainder of the urinary collecting system, which includes the ureters, bladder, and the urethra. In this picture, you will see the stones located in the pelvis of the kidney, and also it can block the pelvis and the calyces of the kidney, which forms the staghorn kidney. Or the stone can be formed, or it can come down in the urinary system, in the ureter, in the bladder, and also in the lower end of the ureter. If we look at the types of the urinary tract stones, the first one is the oxalate stone, and incidence is about 35 to 40%, and sometimes it could be even higher in some of the countries. The characteristics of these stones are small, often possible to get trapped in ureter, and more frequent in men than in women. The predisposing factor could be idiopathic hypercalciuria, hyperoxaluria, and the family history. The second is the calcium phosphate type of stone. Incidence rate is 8 to 10%. Characteristic is mixed stones with struite or oxalate stones, and there could be alkaline urine, and the other predisposing factor could be primary hyperparathyroidism. The third type of the stone could be struite or magnesium ammonium phosphate stone. Incidence is 10 to 15%, and it is 3 to 4 times as common in women as compared to men. Or it is always in association with the urinary tract infection and large staghorn type. And the predisposing factor is recurrent urinary tract infection. The fourth one is the uric acid stone. Incidence rate is 5 to 8%, and it is predominant in men. Predisposing factor is gout, acidic urine, and inherited condition. And the last type of the stone is cystine stone, and the incidence rate is 1 to 2%. Characteristics are denoted as genetic autosomal recessive defect, defective absorption of cystine in GI tract and kidney, excess concentration causing stone formation, and predisposing factor is the acidic urine. So we can see that there are 5 types of stones: calcium phosphate stones, calcium oxalate, uric acid stones, struite, and cystine stones. The risk factors for development of these calculi are metabolic, which could be in the form of abnormalities that result in increased urine levels of calcium, oxaluric acid, uric acid, or citric acid. Climatic conditions, if it is considered, it occurs in the warm climates that cause increased fluid loss, low urine volume, and increased solute concentration in urine. Diet, where there is large intake of dietary proteins that increases uric acid excretion, excessive amounts of tea or fruit juices that elevate urinary oxalate level, large amount of calcium and oxalate, low fluid intake that increases urinary concentration. The genetic factor is family history of stone formation, cystinuria, gout, or renal acidosis. Lifestyle, sedentary occupation, and immobility. Pathophysiology. In pathophysiology, considering the predisposing factors, there could be urine supersaturation, could be in the form of uric acid, oxalate, or any of the type of stones. So those minerals will get supersaturated in the urine, which in turn forms the nucleus. Crystallization and aggregation occurs, matrix formation, which leads to a hard stone, and it can occur anywhere in the kidney, and it can run down in the ureter, bladder, and lower end of the ureter. So once the stones are formed, the clinical manifestations in acute type of pain could be severe flank pain, abdominal pain, nausea and vomiting, fatigue, elevated temperature, BP and respirations, steady pain, pain on urination, which could be the urine color could be pink, red, or brown. Oliguria and anuria in obstruction is very well seen in very acute cases. Hematuria, or there is blood in the urine. Renal colic, a typical type of pain in the flank region which could be radiated downwards, and there is hydronephrosis. The diagnostic tests are for a renal calculi are blood tests for calcium, phosphorus, uric acid and electrolytes, BUN and creatinine to assess kidney function, urine analysis to check for crystals, bacteria, blood and white cells, examination of past stones to determine their type, abdominal x-rays, IVP, retrograde pyelogram, ultrasound of the kidney, which is a preferred test, MRI scan of the abdomen and kidneys, and abdominal CT scan. Briefly talking about the medical management is, since pain is the prominent symptom, pain relief may require narcotic medications. The presence of infection requires treatment with antibiotics. Other medications could include allopurinol for uric acid stones, thiazide diuretics to prevent calcium stones from forming, sodium bicarbonate or sodium citrate to make the urine less acidic, phosphorus solutions to prevent calcium stones from forming, brufen for pain, acetaminophen or Tylenol for pain, and naproxen sodium for pain. Further, considering the management, even the pain and the symptoms do not subside with the medications, the further management could be in the form of lithotripsy. Lithotripsy is an extracorporeal shockwave treatment, or lithotripsy, which uses sound waves to break up large stones so that they can more easily pass down the ureters into the bladder. Next procedure could be of percutaneous nephrolithotomy, wherein a surgeon removes the stones through a small incision in the back of the patient, that is near the kidney area, and the person may need this procedure when the stone causes obstruction and infection or is damaging the kidneys. The stone has grown too large to pass and pain can't be managed. Ureteroscopy is when a stone is stuck in the ureter or bladder. The doctor may use an instrument called a ureteroscope to remove it. A small wire with a camera attached is inserted into the urethra and passed into the bladder. The doctor then uses a small cage to snag the stone and remove it. The stone is then sent to the laboratory for analysis. Thank you. If you have any suggestions or questions, please comment below.